This says, well, the pharmacy agreement is a really important contract that the federal government, on behalf of taxpayers, has with our pharmacists. I think it's important, Trent, that people understand that agreement, but into the negotiations has come the AMA. They say it's time we need big supermarkets selling drugs. They want it online as well. And they're even talking about vending machines inside GP clinics, but I think that's to rile you up. What do you make of the intervention?
Oh, listen, Peter, you know, I'm not going to bite. I said, this is just farcical and, quite frankly, laughable. I mean, let's look at last year in the pandemic when GP surgeries closed and transitioned to telehealth, when emergency departments shut and we delayed elective surgery. Who stayed open, Peter? I'll tell you who stayed open. That was community pharmacy. So, you know, I think the average Aussie, the average punter, you know, just sees straight through this for what it is. It's a distraction from the fact that the AMA has falling membership. It's a distraction from the fact that only on the weekend their Victorian chapter tried to secede from the national body. They've got membership now below 20%. But, you know, besides them, I don't want to talk about them. What I want to talk about is Australians' access to their local community pharmacy. And they know that in the height of the global pandemic, we were there for them. We stayed open. We were scared, just like they were scared. But we didn't hide behind telemedicine from our kitchen tables. We stayed open and we picked up the slack. And, you know, a vending machine can't do that, can it? So I think this is just nonsense.
Yeah, I've got to say too, I mean, I've long been on the side of the Pharmacy Guild in this argument in public policy. I mean, I grew up in a country area where having a doctor in the town was hit and miss, and also from a family with, you know, 4 kids where you didn't get to go to the doctor if you were sick. You went to the pharmacist first, and they were like the triage, because it was no cost to walk in and talk to a pharmacist for mum and dad. And I think a lot of Australians, particularly lower income Australians, older Australians, value the relationship they have with their pharmacy. If that was to change, if supermarkets entered the fray, what would that do to the way the pharmacies in this country operate, as opposed to, say, the United States?
Well, I don't think any Aussie wants an American-style healthcare system. And we've seen many states in the US deregulate and then re-regulate again. We saw many countries in Europe since the European Union was created, and, you know, the boffins in Brussels got control of you know, the regulation and made different countries conform to what they thought was the best thing. And it's been to their folly. They've had to re-regulate location rules to ensure that, just as you've just said, Peter, people living in regional, rural and remote locations get the same access to healthcare that those live in big cities do. And, you know, this is not your local GP saying this. Your local GP and your local pharmacists get along exceptionally well. This is the AMA. So let's not confuse the average GP, you know, who works very well with their local community pharmacist. They don't want this. They're not asking for this. We get along really well. We cooperate really well. We look after the same patients. They're our patients. We share them. And, you know, there are over 400 towns, 400, Peter, in regional, rural and remote Australia, where the local community pharmacy is the only part of primary healthcare infrastructure. And, you know, in today's week, the 1st of November, local community pharmacies are now providing testing kits, take-home testing kits for COVID-19. This week, the Pfizer vaccine will start to be made available for booster shots through your local community pharmacy. So this week, pharmacy's talking not about ourselves, we're talking about you and how we can help you get out of this COVID-19 pandemic. And I think that that's a good leaf that the other professions could take out of our book. They should stop talking about themselves and they should start talking about the people they look after.
Just before we go, talk to me about online medicine, because online drug delivery, not telehealth, but the delivery of pharmacy medicines online in that environment. The AMA supports that. There are real risks, says the Pharmacy Guild. Tell us more.
Well, listen, we know that times are changing and that people want to be able to access the community pharmacy when and how they want. And it's true that 97% of Australians live within 2.5 kilometres of a pharmacy, 97%. But you know what? We're not open, all of us, 24 hours a day, 7 days a week. Some of us are, though. But we know you need to access your community pharmacy at a time of your choosing, which is why now, Peter, over 90% of community pharmacies in Australia have an app that you can download on your mobile phone, and you can book a vaccine, you can order your prescription when it suits you, and you can have it home delivered. And that's happening right now. So we don't need, this theoretical deregulation conversation about what might be good in the United States. We don't want that US stuff here in Australia. What we want to support our local community pharmacy network so the community pharmacy network can do what they do best and support Australians.
All right, Trent Twomey, I'll leave it there. Thank you for your time.